Hello, I am Dr. Sayan Ghosh, consultant endocrinologist, ILS Hospital, Howrah. Today, I am discuss about a case of an uncontrolled diabetes mellitus with recurrent episodes of hypoglycemia. This is a 50-year-old female patient, type 2 diabetes for last 2 years. Patient came with a frequent episodes of hypoglycemic events in the past 2 months. Patient is on oral anti-diabetic medications like metformin 1 gram twice daily and sulfonylureas 2 milligram twice daily. On the laboratory findings, patient diabetic status is uncontrolled because the HbA1c was 8.2% and the heart creatinine value is 1.1. eGFR is more or less at stage 2 within normal range, that is 65 ml per minute per meter square, and lipid profile is more or less within normal limit. And on examination, patient is obese and normotensive. So in this background, that is a poorly controlled diabetes on OADs and with history of recurrent episodes of hypoglycemic event, it is now our target to optimize the glycemic control with a proper cardio-renal protection. That is the primary treatment consideration in this patient. So in this background, it is prudent to optimize the glycemic control with cardio-renal protection, and that is the main primary treatment consideration for this patient. And HbA1c goal for many non-pregnant adults is usually less than 7% is appropriate. And on the basis of the provider judgment, the patient preference and achievement to lower the HbA1c level, we can lower the goal up to 6.5% or less, but it may be acceptable if this can be achieved safely without any significant episodes of hypoglycemia or any other adverse effect of the treatment. Now, in the background of the case, in the current scenario of type 2 diabetes mellitus in our country in 21st century, the type 2 diabetes has reached the epidemic proportion globally. And Indians mainly have the tendency to have a younger onset of type 2 diabetes mellitus, and their pattern of obesity, more visceral adiposity, that is a high risk for the insulin resistance. And for that, and they are more prone to develop accelerated risks for developing diabetic related complications, making it more essential to address this pathology early in the disease course and with available novel therapies, that is mainly pathophysiologic approach of type 2 diabetes management, not only the glucocentric approach, and that is mainly specified for to minimize the risks of adverse event like prominently the weight gain and the risks of hypoglycemia. So the strict glycemic control is critically important in the people with type 2 diabetes, and along with that proper cardiac and renal protection, and along with it the less chances of hypoglycemia and lesser weight gain or more or less weight loss is more acceptable nowadays. Now, in this background, the sulfonylureas play a pivotal role in glycemic control. We know it reduces glucose level significantly. But as a direct extension of their mechanism of action, that we all know that it is glucose-independent insulin secretagogue. So there is a risk of hypoglycemia is increased with the use of sulfonylurea. And these risks may be further increased in the patient with renal impairment, which is a very much common complications of type 2 diabetes mellitus, and the chances of hypoglycemia is a major concern for the user of sulfonylureas. And magnitude and severity of sulfonylurea induced hypoglycemia ranges widely across the studies, and it is also poorly controlled with oral glucose intake than the insulin-induced hypoglycemia. And there is a strong rationale for combining of DPP-4 inhibitor and CV protective class of SGLT2 inhibitor in the patient with type 2 diabetes, because these two drugs exert the different and complementary glucose lowering effect. And furthermore, the increase of the glucagon level that is mainly done by the SGLT2 inhibitor that effect can be blunted by the co-administration of DPP-4 inhibitor. Ultimately, the DPP-4 inhibitor reduces the glucagon level at the state of hyperglycemia. And clinical evidence shows that the SGLT2 inhibitor and DPP-4 inhibitor combination is an effective option for the management of type 2 diabetes. and providing HbA1c reduction up to 1.1 to 1.5% and weight reduction of approximately 2 kg when added to metformin, and which is its primary place in therapy. So the American Diabetic Association recommends the initial combination therapy should be considered in the patient presenting with HbA1c level 1.5 to 2% above the target, considering the absolute effectiveness of most of oral medication that rarely exceed 1%, because usually the dual therapy is recommended after 8% of the HbA1c level, and it is prudent to use this dual therapy for the better glycemic control initially, and also the comprehensive approach by multiple pathophysiologic mechanism of the different molecule. And this unique combination lends itself readily to early treatment intensification because of the good tolerability, the very much lower risks of hypoglycemia, and possibly the chances of weight loss, not weight gain, and minimum treatment burden. And the clinical experience with DPP-4 inhibitor and SGLT2 inhibitor combination shows that they can be used with a good safety profile and a low risk of adverse event like hypoglycemia and the weight gain. And even when added to the metformin, which is particularly important finding for the clinicians. But the major drawback for SGLT2 inhibitor is the recurrent genital infection or the urinary tract infections. But there is a study says that there is reduction in the incidence of genital infection of SGLT2 inhibitor if it is co-administered with DPP-4 inhibitor, and that has been reported when DPP-4 inhibitor is added to the patient taking SGLT2 inhibitor, and that there are several mechanisms can be postulated. The better mechanism is for a higher or the better glucose control in the patient taking dual therapies of SGLT2 inhibitor and DPP-4 inhibitor. And the other possible mechanism also there, and that remains to be investigated properly. So it is better to use the DPP-4 inhibitor and SGLT2 inhibitor in combination for a patient with type 2 diabetes mellitus, especially those patients have overweight and obese, and there is a history of recurrent hypoglycemic event, because they protect those patients from cardiac background also and from the renal background, and they induce the weight loss, and also it lowers the chances of hypoglycemia in comparison to the commonly used sulfonylureas therapy. Thank you.